Welcome to today's video about side effects of methotrexate. Methotrexate has transformed the lives of millions dealing with rheumatoid arthritis, psoriasis, and other inflammatory conditions. Since becoming available for treating arthritis in the 1980s, this medication has been a cornerstone of treatment, helping countless individuals achieve remission and improved quality of life. But here's what many people don't realize when they first receive their prescription. This powerful medication comes with a complex profile of side effects that deserve your full attention. Today, we're diving deep into the 10 most significant side effects of methotrexate that research has documented, and more importantly, what they mean for your health. Whether you're considering starting this medication or you've been taking it for years, this information could be crucial for your well-being. Stay with me through this entire video, because understanding these side effects might just be the key to managing your treatment successfully. Now, let's go through the side effects of methotrexate, beginning with number 1. Nausea and gastrointestinal upset. The most common complaint among methotrexate users affects the digestive system. Research reveals that gastrointestinal issues occur in 32 to 56% of patients with rheumatoid arthritis taking methotrexate. A cross-sectional study found 55.7% of patients were classified as intolerant based on standardized severity scoring. Symptoms include persistent nausea, vomiting, abdominal pain, and significant loss of appetite impacting daily nutrition. A comprehensive study in the Arthritis Power Registry found that approximately 61% of current methotrexate users reported at least one side effect, with gastrointestinal symptoms being primary. What makes this particularly interesting is the timing. Research documented that nausea typically spikes within 6 to 36 hours after the weekly dose, then gradually improves in the 96 to 144-hour window. Understanding this pattern means you can plan dose timing strategically, perhaps taking it Friday evening so weekend discomfort doesn't interfere with work. Studies show that folic acid supplementation can reduce gastrointestinal problems by 79%, making it essential. The mechanism relates to how methotrexate affects rapidly dividing cells in the gastrointestinal tract lining and depletes folate stores. Next, side effect number 2. Mouth sores and oral ulcers. As many as 1/3 of rheumatoid arthritis patients taking methotrexate develop painful mouth sores or ulcers, according to the Arthritis Foundation. These aren't typical canker sores. Methotrexate-induced oral lesions can be severe, appearing on the tongue, inside cheeks, or throughout the oral cavity. A study analyzing 794 rheumatoid arthritis patients found oral ulcers in 6.2% of patients, with 30% reporting previous ulcers. Among detected ulcers, 44.9% manifested as deep irregular ulcers, 30.6% as Aphthous-like ulcers, and 14.3% as diffuse mucositis. These ulcers can make eating and drinking extremely difficult, significantly impacting nutrition and quality of life. Mouth sores often serve as an early warning sign of methotrexate toxicity, especially when the body isn't getting enough folic acid. Average healing time after stopping medication is approximately 3 weeks, though this varies. Patients who develop oral ulcers often weren't taking adequate folic acid supplements, highlighting the critical importance of this protective measure. Higher doses and longer durations were detected among patients with generalized oral ulcers. Dentists and healthcare providers should always be informed about methotrexate use, as these mouth sores can be mistaken for herpes simplex infections or allergic reactions. Next, side effect number 3, hair thinning and hair loss. Here's something that might surprise you about methotrexate and your hair. While complete hair loss is uncommon with low doses used for arthritis, hair thinning occurs more frequently than expected. Research found that approximately 29.4% of patients experienced increased hair loss after beginning methotrexate, with women representing 60% affected. This isn't the dramatic hair loss associated with cancer chemotherapy. Patients typically notice more hair in their brush, shower drain, or pillow. The thinning tends to be gradual and usually reversible when medication is adjusted or stopped. What's fascinating is methotrexate's paradoxical effect on hair. While it can cause thinning in some patients, other studies used methotrexate to treat severe alopecia areata, with some patients showing regrowth greater than 50%. A systematic review found methotrexate appears promising for treatment of severe alopecia areata when used alone or with corticosteroids. The medication affects hair follicle cells, which are rapidly dividing and susceptible to methotrexate's mechanism. Folic acid supplementation may help reduce this side effect, though evidence is less robust than for gastrointestinal symptoms. Many dermatologists recommend biotin supplementation as additional protection. If you notice hair changes, don't suffer in silence. Discuss it with your rheumatologist, as dosage adjustments or switching to injectable methotrexate sometimes resolves the issue. Next, side effect number 4, elevated liver enzymes and liver damage. Your liver deserves special attention when you're on methotrexate. Studies show mild elevations in liver enzyme levels are common, occurring in 39 to 49% of patients. A meta-analysis found methotrexate was associated with increased risk of elevated transaminases. Long-term or higher dose use can potentially lead to liver fibrosis or cirrhosis, though severe complications are rare with modern monitoring. A comprehensive review analyzing 2,179 patients with liver histology showed mild fibrosis in 15.3%, moderate to severe fibrosis in 1.3%, and cirrhosis in 0.5%. The challenge with methotrexate-related liver issues is their silent nature. Unlike acute liver problems causing obvious symptoms like jaundice, methotrexate-induced changes often develop without noticeable symptoms. Regular blood tests monitoring liver function are absolutely essential. Research found the incidence rate of liver enzyme elevation is 13 per 100 patient years with low-dose therapy. Recent research suggests risk may have been overestimated. A study using modern, non-invasive markers found that metabolic risk factors like obesity, diabetes, and non-alcoholic fatty liver disease contribute significantly more to liver problems than methotrexate itself. However, alcohol consumption combined with methotrexate creates a dangerous combination that dramatically increases liver toxicity risk and must be avoided. Next, side effect number 5, bone marrow suppression and low blood counts. Methotrexate can suppress bone marrow function, leading to reduced blood cell production. This means potentially lower white blood cells, increasing infection risk, lower red blood cells causing anemia, and lower platelets, raising bleeding risk. Research found that non-use of folic acid supplements, concurrent medications, and low renal function were significantly associated with developing myelosuppression. A study analyzing 40 cases found approximately 28% developed bone marrow suppression, with severe cases in about 40% of those affected. What makes this concerning is its unpredictable nature. Studies document rapid development, sometimes within weeks of starting treatment, even in patients with previously normal blood counts. A British medical journal review found bone marrow suppression can progress from normal counts to severe pancytopenia, requiring immediate hospitalization. The condition necessitates intensive treatment with folinic acid rescue, blood product transfusions, and sometimes growth factor support. While methotrexate is generally well tolerated with low incidence, severe cases can be life-threatening. Research shows bone marrow suppression can occur abruptly, anytime during therapy, not just early months. Risk factors include older age with mean of 68 years versus 50 years in those without toxicity, reduced kidney function with baseline creatinine of 1.3 versus 0.9, drug interactions particularly with certain antibiotics and NSAIDs, and inadequate folic acid supplementation. Next, side effect number 6, lung problems including pneumonitis. Methotrexate-induced pneumonitis, an inflammation of lung tissue, occurs in 0.3 to 11.6% of patients, with pooled median prevalence around 5.1%, according to systematic reviews. Symptoms can be deceptively nonspecific: progressive shortness of breath, dry cough, fever, and fatigue developing gradually over weeks to months. Research describes it as a T-cell-mediated hypersensitivity reaction rather than direct toxic effect, meaning it can occur at any dose and any time during treatment, even after years of uncomplicated use. The challenge is distinguishing methotrexate pneumonitis from lung involvement related to underlying rheumatoid arthritis or respiratory infections like pneumocystis jirovecii pneumonia. Chest imaging shows characteristic ground glass opacities on CT scans, though findings aren't specific to methotrexate. When methotrexate pneumonitis is suspected, immediate discontinuation is essential. Research shows that with prompt recognition and treatment, most patients recover fully within approximately 31 days on average, though acute mortality rate can be 10 to 20% in severe cases. Corticosteroid treatment accelerates resolution in severe or fulminant cases. Risk factors include older age, diabetes, hypoalbuminemia, previous lung disease, male gender, and higher health assessment questionnaire scores. A case report documented pneumonitis occurring even after 30 years of use, emphasizing vigilance is required throughout treatment. Anyone developing new respiratory symptoms, including cough or breathing problems, should seek immediate medical evaluation. Next, side effect number 7, kidney toxicity and dysfunction. Your kidneys play a crucial role in eliminating methotrexate, accounting for 70 to 90% of clearance. When kidney function is impaired, methotrexate can accumulate, leading to increased toxicity. For low-dose weekly regimens used in rheumatoid arthritis, a landmark trial examining 4,186 patients found something unexpected. Those taking low-dose methotrexate had less decline in kidney function with 27% reduced rate of kidney adverse events compared to placebo over 23-month follow-up. This contradicts older beliefs about methotrexate inevitably harming kidneys. However, research shows methotrexate at 12 mmol per week or higher was associated with decreased 1-year estimated glomerular filtration rate with beta coefficient of -2.5 compared to lower doses of 8 to 12 ml weekly. Studies found methotrexate is contraindicated when kidney function falls below certain thresholds, specifically when creatinine clearance is less than 30 ml per minute. High-dose methotrexate used in cancer treatment carries acute kidney injury incidence of 1.8 to 38.6%. The interaction between kidney function and methotrexate toxicity creates a dangerous cycle. Reduced kidney function slows elimination, leading to higher drug levels, which can cause further kidney damage and bone marrow suppression. Regular monitoring through blood tests, measuring creatinine, and estimated glomerular filtration rate is essential for safe use. Next, side effect number 8. Skin reactions and light sensitivity. Methotrexate can affect skin in multiple ways. Skin-related side effects include various rashes, increased sensitivity to sunlight, causing easier burning, reddening of skin, and in some cases, unusual reactions. Research examining side effects found that while skin reactions occur less frequently than gastrointestinal or liver issues, they remain clinically significant. The photosensitivity reaction deserves particular attention. Patients often find themselves burning more easily than before, even with previously tolerated sun exposure. This represents real risk for skin damage. Medical literature describes severe sunburn-like reactions with minimal sun exposure. Some patients develop specific rashes that can be mistaken for other conditions. Studies report various presentations including maculopapular rashes, itching, and urticarial reactions. Skin reactions can sometimes indicate serious hypersensitivity to methotrexate. Cancer Research UK documentation notes skin changes such as rash, itching, or reddening occur in fewer than 1 in 100 people taking methotrexate. If you develop new or worsening skin symptoms, particularly if accompanied by fever or systemic symptoms, immediate medical evaluation is warranted. Preventive measures are straightforward. Consistent use of broad-spectrum sunscreen with SPF 30 or higher, protective clothing including hats and long sleeves, seeking shade during peak sun hours between 10 a.m. and 4 p.m., and being cautious if taking other medications that might also increase sun sensitivity, such as certain antibiotics or diuretics. Next, side effect number 9, fatigue, headaches, and general malaise. Many patients describe methotrexate fog, or the methotrexate blahs, and research confirms these experiences are real. Studies found fatigue was experienced by approximately 45.6% of current methotrexate users and 44.7% of past users, making it one of the most common side effects. The fatigue isn't just ordinary tiredness. Patients describe feeling wiped out, foggy-headed, and generally unwell, particularly in the day or two following their weekly dose. Research documented this temporal relationship, showing fatigue scores increased significantly in the 6 to 36-hour window after taking methotrexate, with mean increase of 3.9 units in those reporting baseline fatigue. Headaches are another frequently reported symptom, occurring in approximately 19% of early rheumatoid arthritis patients starting methotrexate. Research examining central nervous system effects found older patients with mean age of 68 years and mild kidney impairment with baseline creatinine of 1.3 were more susceptible to cognitive symptoms, including unpleasant cranial sensations, memory impairment, and mood alterations. The mechanism behind methotrexate fatigue likely involves multiple factors: folate depletion affecting energy metabolism, the medication's central nervous system effects, and possibly the body's response to the drug. Practical strategies include taking methotrexate Friday evenings to sleep through worst symptoms and recover over the weekend, ensuring adequate folic acid supplementation of at least 5 mg once weekly, staying well hydrated, and maintaining gentle physical activity, which research shows can help combat medication-related fatigue. Next, side effect number 10, increased infection risk and immunosuppression. As an immunosuppressive medication, methotrexate reduces immune activity, which is how it helps control autoimmune diseases. But this means potentially increased vulnerability to infections. A comprehensive systematic review and meta-analysis of 12 randomized controlled trials with 1,146 total patients found methotrexate was associated with a small but significant increased risk of infection in rheumatoid arthritis patients, with risk ratio of 1.25 and 95% confidence interval of 1.01 to 1.56. However, research reveals important nuances. There was no increased risk of total or serious infections in all inflammatory rheumatic diseases included in the review. The elevated infection risk appeared specific to rheumatoid arthritis populations rather than other conditions like psoriasis or psoriatic arthritis. Studies report patients on methotrexate may face higher incidences of various bacterial and opportunistic infections, including respiratory infections, urinary tract infections, and in rare cases, unusual infections like cryptococcosis, cytomegalovirus pneumonia, or pneumocystis carinii pneumonia. Infection types typically seen are similar to the general population, just occurring somewhat more frequently. What's particularly reassuring is that during the COVID-19 pandemic, studies found low-dose methotrexate didn't predispose patients to more severe COVID-19. Some research suggested patients on methotrexate experienced milder disease, possibly due to reduced severe inflammatory reactions. The key to managing infection risk involves staying current with vaccinations, including annual influenza and pneumococcal vaccines, promptly treating infections that develop, maintaining good hygiene practices, and being aware common infections might require earlier medical attention. Understanding these 10 side effects of methotrexate isn't meant to scare you away from a medication that has genuinely transformed treatment for inflammatory diseases. Rather, this knowledge empowers you to work more effectively with your healthcare team. Recognize warning signs early and take preventive measures that can make your treatment journey safer and more successful. Remember, most patients tolerate methotrexate well, especially with proper monitoring, folic acid supplementation, and open communication with their doctors. The key is being informed, staying vigilant, and never hesitating to report new or concerning symptoms. If you found this information valuable, please type "helpful" in the comments below. Your feedback motivates us to continue creating well-researched health content that makes a real difference in people's lives. Don't forget to give this video a thumbs up, share it with anyone who might benefit from this information, and subscribe to our channel for more evidence-based health insights. Thank you for taking the time to educate yourself about your health. Stay informed, stay healthy, and remember that knowledge is your best tool for managing any medication safely and effectively.